Hello, my name is Dr. Tammy Gutierrez, and I am a fellow Hershey parent, but I'm also a physician. And so I was asked to talk briefly about what to do if your kiddos or you have symptoms this year and you think you're sick. Hershey has created a form that's going out on Transparent Classroom and also on paper, if you prefer, to kind of check off symptoms. And it's kind of clear if you have the major symptoms that are strongly suggestive of COVID. Of course, no one's going to go to school with those. But on the other side, there's questions about, well, what to do if my daughter wakes up with the sniffles and is otherwise fine. And so in general, I think what people need to understand is that, of course, our kids are going to get little colds. They're going to have little tummy upsets. Other stuff's going to happen this year, just like it always does. And so unfortunately, COVID in its mild form is very hard to tell apart from those things. And so the rule of thumb that we're asking you to follow is, if you think your child is contagious, right, that this isn't from playing in the dusty attic yesterday for 2 hours before bedtime, if you think those snuffles are the start of a cold that other people can catch, then you keep your child home for a day or two and you watch him or her to make sure that it's not evolving into something that looks more serious. Or if you have 2 or more people at home with symptoms, right, that almost guarantees it's contagious. So you keep the contagious people home for that time frame and let them get past that, and then you can send them back to school. It doesn't mean everybody has COVID every time. It just means that if we do that, and if we take 1 or 2 days off of work when our kids have something mild, then we don't have to take 14 days off of work because the whole cohort is in quarantine for some suspected COVID infection. And that's really the point, is that to keep as many of the kids as possible in school as many of the days as possible and avoid having tons of shutdowns and transitions to online learning, which I think, at least if your kids are like my kids, they would really like to be in person. And so we really just need to be a little bit more willing to bite the bullet and be home for a day or two now, so that we don't have to be home for 14 days shortly after. Okay, I hope that's helpful. And I know this is crazy and stressful, and we will get through it if we can all just be team players. Thanks.